During inhalation, air containing oxygen passes through the nose and mouth to the lungs. During exhalation, air containing carbon dioxide and other waste passes out the same path. This process of moving air in and out of the lungs is called pulmonary ventilation. In the lungs, oxygen travels from tiny air sacs called alveoli into the bloodstream. At the same time, carbon dioxide travels from the bloodstream into the alveoli for elimination. This process of gas exchange between the lungs and the blood is called external respiration. Internal respiration exchanges gases between the blood and the body's cells. The trachea conveys air between upper and lower respiratory structures. This flexible tube extends from the larynx to the upper chest, where it divides into the bronchi. Between 15 and 20 cartilaginous C-shaped rings keep the trachea from collapsing or overexpanding. The shape of these cartilaginous rings allows the trachea to change shape to accommodate masses of food passing through the esophagus. Smooth muscle of the trachea can contract to decrease its diameter, which allows air to be expelled out of the lungs more forcefully during coughing. The trachea divides into the bronchi and bronchioles in the lungs. Relaxation of smooth muscle in the bronchioles during exercise causes them to dilate. This bronchodilation allows greater ventilation. Allergic reactions and histamines cause the opposite effect, known as bronchoconstriction.
The lungs and the air pressure within them. During normal inhalation, the diaphragm and external intercostal muscles contract and the ribcage elevates. As the volume of the lungs increases, air pressure in the lungs drops below atmospheric pressure and air rushes in. During normal exhalation, the muscles relax, the lungs become smaller, pressure inside them rises, and air is expelled. Boyle's law explains this relationship between volume and air pressure. An increase in the volume of a container lowers the pressure of the air inside. A decrease in the volume raises pressure in the reduced space. The body's demand for more oxygen can change normal breathing to forced breathing. Additional muscles increase the changes in volume of the thoracic cavity so that more air can pass in and out more rapidly. Respiration is an involuntary function. Nerve impulses transmitted by the pons and the medulla oblongata to respiratory muscles regulate the respiratory rate. The rate of normal breathing is 12 to 15 breaths per minute. The body adjusts the rate and depth of normal breathing in response to metabolic needs. When the body uses more oxygen or holds too much carbon dioxide, sensors in the circulatory system, called chemoreceptors, send signals to the brain. The rate and depth of ventilation or breathing increases so that more gas can be exchanged. Involuntary breathing mechanisms can be overridden by the cerebral cortex. Actions, including talking, sneezing, and coughing, can also alter breathing patterns for short periods of time.
Inside the lungs, oxygen from the air is exchanged for waste carbon dioxide from the bloodstream. This process of external respiration takes place in hundreds of millions of microscopic sacs called alveoli. Oxygen from inhaled air diffuses from the alveoli into the pulmonary capillaries surrounding them and is pumped through the bloodstream. Carbon dioxide from oxygen-depleted blood diffuses from the capillaries into the alveoli and is expelled through exhalation.
As oxygen diffuses from alveoli into the bloodstream and carbon dioxide diffuses from the bloodstream into the alveoli, Dalton's law explains that in a gas mixture, the pressure exerted by each gas is independent. The gas mixture in the alveolus has a high oxygen partial pressure, while the partial pressure of oxygen in the surrounding pulmonary capillaries is low. For this reason, the oxygen-diffused alveolus sneezing is an involuntary expiration of air to rid the nasal passages of foreign material. Particles that enter the nostrils and irritate nerve endings in the nasal mucosa trigger impulses that are transmitted via the fifth cranial nerve to the brain's sneezing center in the medulla. This sets off a respiratory response. Rapid inspiration fills the lungs, the epiglottis and vocal cords close, and the muscles of exhalation in the chest and abdomen tighten in a spasmodic contraction. These events create a buildup of pressure in the lungs. When a sufficiently high level of pressure is attained, the vocal cords relax, the epiglottis opens, and an expulsion of air rushes through the nose and mouth. The force of the sneeze propels the irritants out of the nasal cavity. During exhalation, air passes from the lungs through the larynx. Muscles in the larynx can act to move the arytenoid cartilages that then move the cords. The cords are pushed together and air passes between them in such a way as to make them vibrate, creating sound. Greater tension in the vocal folds creates more rapid vibrations and higher-pitched sounds. Lower tension causes slower vibration and a lower pitch. Sounds can also be altered by other factors. High pressure creates louder sound. Shorter folds produce lower pitch sounds, and longer folds produce higher pitch. Structures in the oral and nasal cavities can also modify the sounds produced by the vocal folds. The paranasal sinuses that surround the nasal passages help drain mucus and keep the passages open. Airborne allergens and viral or bacterial infection can cause the mucous membranes of the sinuses to swell and become inflamed, blocking the sinus openings and preventing the mucus from draining normally.
Chronic obstructive pulmonary disease, or COPD, is a chronic respiratory disorder, usually caused by smoking or inhalation of pollutants. The two main types of COPD are chronic bronchitis and emphysema. In chronic bronchitis, inflamed airways constrict and generate excess mucus, making it difficult to breathe. In emphysema, the alveoli in the lungs become damaged, interfering with oxygen absorption and making the patient feel short of breath. Asthma is a chronic disorder characterized by inflammation and constriction of the airways. It can be triggered by the inhalation of particles from the air or by factors like physical activity and respiratory infections. An asthma attack occurs when the inflamed airways become irritated during inhalation. Smooth muscle in the airway wall tightens, resulting in bronchoconstriction and excess mucus production. The narrowed and obstructed airway restricts normal airflow to and from the lungs. This causes symptoms like wheezing, coughing, and difficulty breathing. Treatments for asthma focus on relaxing muscles around the airways and reducing inflammation.
A condition in which a blood clot forms in a deep blood vessel, usually a vein in the leg. Part of the blood clot can break free and travel upwards through the veins of the body until it reaches the pulmonary circulation loop. When the clot becomes lodged in a pulmonary artery, it cuts off blood supply to part of the lung, damaging or destroying lung tissue.